In today's bite-sized episode, we're turning back the clock to explore the deadliest pandemic in history in terms of death toll, the Spanish flu of 1918 to 1920. While the COVID-19 pandemic is still fresh in our collective memory, the Spanish flu offers a haunting historical parallel. Just as the most devastating war ever seen in human history up until that point, that claimed an estimated 20 million lives, was winding to a close, this invisible enemy swept across the globe, claiming millions of lives and reshaping societies. But what exactly was the Spanish flu? How did it manage to spread so quickly in an already ravaged world? And what lasting lessons can we draw from it over a century later? Let's dive into this pivotal moment in history. In 1918, the world was already in chaos as the First World War neared its end. The unprecedented global movement of soldiers, supplies, and refugees created the ideal conditions for a pandemic. Soldiers crowded into trenches and barracks, civilians packed into cities, and governments, consumed by the war effort, had limited capacity to address public health. Although called the Spanish flu, researchers think that the virus likely originated in the United States. One of the earliest recorded cases appeared on the 11th of March 1918 at Fort Riley in Kansas, where overcrowded and unsanitary conditions at an army camp facilitated its spread. Within a week, 522 soldiers were hospitalized with an influenza that seemed especially severe. Similar outbreaks soon occurred in army camps across Virginia, South Carolina, Georgia, Florida, Alabama, and California, as well as on Navy ships docked on the East Coast. Initially, the flu primarily affected military personnel rather than civilians, and was overshadowed by pressing issues like prohibition, the suffragette movement, and of course, the First World War. By May 1918, the virus seemed to decline in the US, but the danger was far from over. Troops from Fort Riley carried the virus aboard crowded ships to France, where it quickly escalated into a full-scale outbreak among Allied and Central Powers alike. The illness, often named locally, became known as the three-day fever, or Purple Death amongst US Americans. In France, it was known as purulent bronchitis, and in Italy, it was the sandfly fever, and in Germany, it was the Blitzkatar, or the Flanders fever, filling hospitals on all sides of the war. So, despite its name, the Spanish flu did not originate in Spain. The reason it is called Spanish flu is because Spain, as a neutral country during the First World War, freely reported on the pandemic, while the Allied and Central Powers, who were censoring their press in wartime, concealed the influenza's impact. This led to the misconception that Spain was the epicenter, though the true origin of the virus remains uncertain. Caused by an H1N1 influenza virus, the pandemic was uniquely deadly, especially for young, healthy adults aged 20 to 40. Unlike typical flu strains that disproportionately affect the very young and people over 60 years of age, it triggered cytokine storms, which were immune overreactions led to severe complications like pneumonia, particularly in those with robust immune systems, hence the higher mortality rate amongst younger people. The pandemic unfolded in 3 waves. The first, in spring 1918, was relatively mild. The second wave, starting in late summer 1918, was far more lethal, spreading rapidly and globally. A third wave in early 1919 was less deadly, but still caused significant fatalities. The disease's severity was exacerbated by secondary bacterial pneumonia, which exploited weakened immune systems. Symptoms ranged from fever, muscle aches, and unproductive coughs to more severe issues like nosebleeds, respiratory distress, and bluish skin from oxygen deprivation. Severe cases often led to bacterial pneumonia, fluid-filled lungs, and septicemia, which were almost always fatal in an era without antibiotics. Autopsies revealed extensive damage, pneumonia in both lungs, hemorrhaging in vital organs, and bleeding from mucous membranes. The pandemic's catastrophic toll and swift spread left an indelible mark on global health and underscored the devastating impact of an invisible enemy. By the time it subsided, the Spanish flu had infected about 1/3 of the world's population, roughly 500 million people, and killed an estimated 50 million worldwide, although some estimates go as high as 100 million. Across the world, schools and churches were closed, mass gatherings were banned, masks were mandated, quarantine measures were implemented, and hygiene was promoted. Sounds very familiar, doesn't it? In some places, the flu overwhelmed health systems to the point where bodies were piled up in the streets. Many historians believe that the flu also affected the outcome of the First World War. It weakened armies on both sides and may have hastened the war's end, as troops fell ill in staggering numbers. The troops returning home after the war's end also increased infection numbers locally. The pandemic exposed the gaps in global health infrastructure and highlighted the need for better disease surveillance, hygiene practices, and medical research. It directly influenced the growth of organizations like the Pan American Health Organization, or PAHO, which worked to improve health systems across the Americas. The Spanish flu of 1918 devastated regions worldwide, with mortality rates shaped by local conditions and resources. India faced catastrophic losses of 12 to 18 million lives due to overcrowding, poor sanitation, and malnutrition under colonial rule. In the US, urban centers like Philadelphia were overwhelmed, as delayed public health measures worsened the outbreak. Western Samoa lost 25% of its population, a result of isolation and limited medical resources. In Alaska and northern Canada, indigenous communities experienced mortality rates as high as 90%, driven by delayed assistance and limited immunity. Africa and Southeast Asia were also severely affected due to colonial exploitation, poverty, and weak healthcare infrastructure. Europe, recovering from the First World War, saw high deaths, particularly among soldiers and malnourished populations. Regions with poor healthcare, overcrowding, and populations weakened by war or exploitation were especially vulnerable to the pandemic's ravages. Amid the grim statistics and scientific lessons, the Spanish flu was also a deeply personal tragedy for millions around the globe. Some of the stories that emerge from this time highlight the resilience, desperation, and humanity of those who lived through it. Take, for example, Philadelphia, one of the cities hardest hit by the pandemic in the United States. In September 1918, the city held a massive parade to support the war effort, despite warnings from health officials about the looming influenza threat. Within 72 hours, every hospital bed in the city was filled, and by the end of the week, thousands had died. This tragic decision became a haunting lesson in the cost of ignoring public health warnings. In Alaska, the flu reached even the most remote communities. The native Inuit populations, who had limited immunity to infectious diseases brought by outsiders, were decimated. Entire villages were wiped out, and survivors faced severe challenges in the harsh Arctic winter, often without family members to help them endure. There's also the story of Sister Mary Gonzaga, a Catholic nun in Philadelphia who worked tirelessly to care for the sick when hospitals were overwhelmed. Alongside volunteers from the clergy, Sister Gonzaga turned convents into makeshift hospitals. Many caregivers, like her, succumbed to the virus themselves while trying to save others, a testament to selflessness during one of humanity's darkest hours. We shouldn't forget the everyday stories of resilience and innovation either. Families devised makeshift remedies and strategies to protect themselves, from wearing garlic necklaces to keeping windows open during the cold winter months, believing fresh air could ward off the virus. Communities banded together to deliver food and medicine to those in quarantine, and acts of kindness often emerged amidst the fear and chaos. These stories are very similar to the stories that emerged during the COVID-19 pandemic, and reminds us that pandemics, whilst devastating, also reveal the depths of human compassion and resourcefulness. They show how individuals and communities navigate extraordinary challenges, leaving legacies of both sorrow and hope. The Spanish flu of 1918 to 1920 wasn't just a public health disaster, it was a global event that profoundly reshaped society, healthcare, and international cooperation. It is often called the forgotten pandemic because it has been overshadowed by the First World War, yet its impact was staggering, with more lives lost in just over a year than in the entire war. The pandemic's legacy serves as a powerful reminder of both human vulnerability and resilience. It taught us how interconnected our modern world truly is, how a virus can transcend borders, socioeconomic classes, and even battle lines. It also highlighted the importance of public health systems, early response mechanisms, and honest communication. Lessons that continue to guide us, as we've seen also during the COVID-19 pandemic. But there's also a deeply human side to this story. From the caregivers risking their lives to help the sick, to the communities that banded together despite immense fear, the Spanish flu reminds us that even in times of great tragedy, humanity's capacity for compassion and perseverance shines through. As we look back on the Spanish flu more than a century later, it's impossible not to reflect on how far we've come, and how far we still have to go in preparing for global health crises. Now, history may not repeat itself exactly, but it does often rhyme, and understanding the past is one of the best ways to prepare for the future, and that is one of the main aims of the Ministry of History. That's all for this episode on the Spanish flu. Many thanks for listening, and see you very soon. Bye!